v-am regăsit, doamnelor, domnilor, din nou aici la Sănătatea Fără Frontiere, așa cum v-am obișnuit, săptămânal alături de noi din Turcia, medici de top, alături de care vom vorbi despre ceea ce înseamnă profesionalism, competență și servicii medicale de calitate, evident. Astăzi, subiectul pe care îl voi aborda alături de cei doi invitați ai mei este rinoplastia. Îi am alături de mine prin intermediul StreamYard pe domnul dr. Hasan Zafer Hircin, care este medic orelist. Hello, doctor!
Hello, hello.
Și pe domnul doctor Ulas Bali. Domnia sa este chirurg plastician și o să vă mai spun despre domnul doctor Ulas Bali că a efectuat cu succes peste 35.000 de operații pe parte de intervenții chirurgicale estetice și este cel mai renumit chirurg plastician din Turcia, Europa și Africa. Hello, Dr. Bali, can you hear me too?
Hello. Hello, I'm
nice to see you, nice to talk to you. We'll start our interview because I know, Dr. Bali, you are going to perform a surgery.
Yes,
so, okay.
yes, I am surgeon.
Okay. My first question for you is, what is functional rhinoplasty? Please tell me.
Let me to tell you about that. A functional septal rhinoplasty is a surgery that includes aesthetic nasal modifications and reconstructions that preserve nasal functions and provide a better breathing of nose than before. First aim of us is function, and we do this function providing with the aesthetic nasal modifications.
I understand. Why is it performed together with an ear, nose, throat physician and a plastic surgeon?
Okay, we perform this operation as two surgeons,
Yes.
Dr. Zafer and me. The fact that two experienced surgeons with a history of numerous nose surgery will perform, the surgeries make our patients happier. Question marks in their minds are minimized, both functional and aesthetic.
The questions in patients' minds that my nose will functionally better or my nose will aesthetically better is not be questionable when we perform two surgeons.
I understand. Does post-operative pain and swelling occur after this kind of intervention?
We do not predict pain in the post-operative period in patients, but swelling and bruising around the eyes subside within 5 to 7 days. We can see swelling and bruising, but we don't predict any pain.
And after these 5, 6, 7 days you spoke about, what happens?
Then after 7 days, there are still swelling, of course. Totally, it removes 6 months. But after 7 days, at 8th day, patients turns normal life.
Okay. What techniques are involved when we talk about this kind of intervention, rhinoplasty?
You and all the world is now. You know, there's two techniques. One of them is open techniques, and the other is the closed techniques. We can perform two type of that, but we usually perform with open technique with Dr. Ulas and me.
Please tell me more about the open techniques and the closed techniques.
Okay, Dr. Ulas.
Please.
We are performing.
I'll ask my colleague to show us some images with rhinoplasty interventions, patients before and after this kind of surgery. Please, doctors.
Yes, we are performing open technique more because closed technique is not better than open. and the swelling, bruising are the same. And also we are using piezo, and it's just cutting the bone. It's not disturbing the soft tissue or any other. So patients are less pain and less swelling, bruising. We are using open technique more because the same results.
I understand. And I would also like to ask you, what is the piezo technique and what are the advantages of this technique, of course?
Yeah, piezo is defined from an Italian man, and it's used. Maybe you know it is it has ultrasound energy, and piezo is a surgical technique that we apply nowadays to almost all patients, and allows us to apply soft shapes to the nose by making use of high sound waves. We use the piezo technique on the dorsal and lateral walls of the nose at the stages that involve almost all bone structure. Since it does not damage the soft tissue, as Dr. Ulas Bali said, at the soft tissue, it causes less swelling and bruising. It allows us to make smoother transitions than other techniques and contributes to obtaining artistic results.
Okay, and my last question, doctors, how does the life of a patient changes physically and emotionally after a rhinoplasty?
It depends on all patients.
You know, do you have any operation to your nose or?
No, I don't have any operations.
You
This is
know,
my natural nose.
functionally it is very important for the patient. You know, it is very important. Your nose is very important for your life, because of its function, and emotionally, the life of women or man is very ne diyelim ya?
More confident.
Yeah, they have more confidence and evlenen
Self-esteem.
insanlar bile değişebiliyor ya.
Yes, the breathing problem, its function, when we solve this problem, the quality of life decreasing normally, and the aesthetic appearance after rhinoplasty, the patients are feeling better psychologically.
I understand. Thank you very much, doctors, for all these informations you offered to our Romanian viewers. Hope to talk to you again. Have a nice day.
Have a nice day. Thank you. Thank you so much. Bye bye.
Au fost așadar, doamnelor și domnilor, domnii doctor Hasan Zafer Hircin, medic orelist și chirurgul plastician Ulas Bali. Am discutat despre ceea ce înseamnă intervenția de rinoplastie, intervenția chirurgicală de remodelare a nasului. Până data viitoare la o nouă întâlnire, evident, cu un alt medic de top din Turcia. Numai bine!